Mr. Siddiqui in very simple take-home message what we should be doing. The next panelist is Dr. Sudhir M. Parikh. He was a Padma Shri awardee in 2010 and Pravasi Bharatiya Diwas Award in 2006, Ellis Island Medal of Honor Award 2005, Chairman Center for Asthma and Allergy, United States of America and Asthma Allergy Medical Care, US, Chairman and Publisher, Parikh Worldwide Media Limited, Clinical Associate Professor, University of Medicine and Dentistry, New Jersey. Sir, please.
Distinguished guests on the dais, Honorable Mr. Didar Singh, Advisor to Ministry of Overseas Indians, and dear friends. Thank you all for having me here today. It's a great honor to be part of this panel. I live in the United States, which is called land of freedom and opportunities, but people from all backgrounds did not have same freedom until Martin Luther King adopted Gandhiji's teaching and of equalities. The American Civil Rights Movement in its early 70s has enabled nearly over 2 million Indians over these past 50 years to become a most successful and prosperous ethnic group in the United States. The Indian Americans have succeeded spectacularly in different walks of life, including politics, business, science, technology, and most of all, in the medicine. Meanwhile, India thrives as the world's largest democracy and has lately emerged as economic powerhouse. Its economy has grown over the times as much as US economy in the past 5 years, 10 times as compared to US economy in last 5 years, 8% versus 0.8%. By 2030, India is expected to surpass China as the most populous nation in the world, and life expectancies will approach that of many Western countries, in the part due to the success of the vaccination and improvement in the India's health services. Hospitals such as Arvinda Hospital, Apollo, bring in patients from US, Europe, Middle East for state-of-art care that is 10 times cheaper according to PricewaterhouseCoopers, a major global accounting firm. This is India's time to realize its potential and become world leader in the healthcare sector. But the major obstacle that we must address is vast inequalities in the access to affordable healthcare, which can be solved by adopting the strategy of inclusive growth in the healthcare sector. Amartya Sen, a native son of West Bengal and Nobel Prize winner economist, recently said, India cannot be seen as doing splendidly if a great many Indians, sometimes most Indians, are having very little improvement, and that inequalities are his main concern. That may prevent the country from doing the wonderful things. Although the country has had an unprecedented growth and one can find everything from the rickshaws to rocket ships, India remains at a crossroad. Despite all its impressive indicators, World Bank still classified India as low-income country due to widespread poverty. So what can be done? So while it has made tremendous progress in vaccination and reducing the infant mortality, diseases once thought to be under well control, such as tuberculosis, malaria, and dengue, are again rising. This troubling trend is due to the lack of public health infrastructure, substandard housing, and poor sanitation. However, I feel that something is a problem only if there is a solution. The solution is inclusive growth in health sector. Inclusive growth in healthcare means that as healthcare expands and improves, so should be its ability to engage those traditionally left outside of the health system, particularly those in the rural areas and urban poor. The prominent The promotion of the medical tourism in India, while directly helping Westerner, can be an avenue for inclusive growth in the creating more jobs for Indian in healthcare sector. The field of cardiology or cardiac surgery, bone marrow transplantation, orthopedic surgery have great potential as Indian hospital can perform this procedure more efficiently and effectively and much cheaper as compared to the Western hospitals. Medical tourism in India will be worth up to 2 billion in 2012. It will increase job and income, which will contribute to resolving many of the social issues that contributes to the poor health. Although improving the medical tourism or promoting medical tourism is an important source of growth, it does not directly fall within the framework of inclusive growth, as it may mostly benefit the urban middle and upper classes, leaving the working classes and poor out of the loop. The revenue from the medical tourism can be a part of inclusive growth. If its profit also, if it profits, if it's used in the public-private sector partnership, we have seen this public-private sector partnership with the Rajiv Gandhi Super Specialty Hospital, a partnership between Government of Karnataka and Apollo Hospital that provides healthcare for the poor, but also generates profit for Apollo and relieves some of the government's burden on providing healthcare for marginalized, so it can invest resources in other things that improves the wellness, such as education. There is also huge demand for expansion of the infrastructure, not only to the poor, but also to the middle class, as more individuals are living longer and chronic diseases such as diabetes are rapidly rising. The WHO estimates that India has 80% less hospital beds per person than world average. 450,000 additional beds were needed in 2010 according to WHO, but government could only provide 20% out of 450,000. NRI investment in the hospital will address a fundamental social need for health services while creating skilled and unskilled jobs and having less productivity lost to the illness. Many homegrown advances in India should also be utilized for inclusive growth. By harnessing India's tech boom, the most important and most probably a productive growth strategy would be a telemedicine. In telemedicine is a way we can increase the wellness of India while growing healthcare sector. Telemedicine is a way for diagnosis, management and treatment of illness from the remote site using the information technology. Currently only 25% of the specialists are in the semi-urban area and only 3% of specialists are in the rural area in India. Bringing the physician to semi-urban and rural area via telemedicine is an excellent way to increase the access in an affordable way to many Indians who would otherwise have no appropriate skill care. Telemedicine is a sustainable way to grow the health sector while improving the access and care. Globally, telemedicine is estimated to be worth 9.8 billion, but India's share today is only 3.4 million. We must strike while iron is hot. Apollo, Sangra Netralaya and other hospitals like AIIMS all began using this telemedicine services, and NRI investment and expertise to this area would improve the health for millions of Indians. The government is also on the board with the Indian Space Research Organization committing to building 100 telemedicine centers across the country in near future. Asian Heart Institute is also planning to build additional 60 centers to address the heart disease in specific particular, which is the leading cause of the death in India. Along with the telemedicine, one must increase the simply number of doctors to the total number of doctors to the population. And there should be a more MBBS physicians and healthcare workers to be appropriately care for the patients. Even if one includes Ayurvedic and homeopathic practitioners, India has fewer physicians than world average. The same story holds true with regard to nurses and other healthcare workers, as we know. Many NRIs are very successful physicians, and healthcare entrepreneur like my friend B.R. Sethi. These people can help India by sponsoring a new medical and healthcare services school and assisting their alma maters in expanding seats at the school. NRI can also volunteer their expertise for the short time each year in an effort to train and empower next generation of Indian health workers. In summary, India is a nation that is the cusp of the greatness and prosperity, but its inequalities may prevent it from fulfilling its true potential. Global Indian can play a major role in inclusive growth of healthcare sector in India that will not only make the society healthier, but help India thrive economically by focusing on telemedicine, health and hospital infrastructure, and expanding the medical education. Today, healthcare in India is a huge slab of marble. If we invest in inclusive healthcare and build upon it, healthcare will be cornerstone of the India's new golden age in future. Thank you very much.